We are recording, so we just want to make this available to as many folks that we can. To our main presentation. This is the PPCL Pediatric Mental Health Tele-Echo. Today's the 9th. I'm Jody West. I am the coordinator of the Tele-Echo. This is the first session of the second cohort. I want to go over a few housekeeping items before we begin. As I've asked and you've done probably, go ahead and enter your name, title, organization, email address in the chat. That's how we track attendance. This is our agenda for today. Sorry about the formatting. It shifts every time we transfer it from one format to another, but we're going to try to keep the schedule as much as we can. After we do some announcements, Dr. Olivia is going to be our facilitator and she'll lead us in brief introductions. And then we'll pass to Jen Bordelon, who's going to be our case presenter today. We'll ask for any clarifying questions and recommendations from the participants as well as the hub team. And once all questions have been answered and those recommendations given, we will go ahead and summarize all of those recommendations and send them to Jen, so you don't have to worry about taking any kind of notes. Our presentation today is going to be given by Dr. Olivier, and then after that, we will wrap up with any announcements and close the session and provide the link for continuing education credits for those that are interested. So at this time, Dr. Olivier, if you could lead us in introductions, please.
Sure. Good morning, everybody. I'm Dr. Christine Olivier. I'm a child and adolescent psychiatrist over here in Lafayette, Louisiana. I have a private practice called Bloom Mental Wellness. This is our second round for this PPCL Echo, and we have a bigger group this time around. So welcome. We're happy to have you. I'm going to go ahead and introduce your hub team. These are your team of experts that are going to lead the discussions. I'm the facilitator, so I am the one who's making sure we stay on time and leading into the next part of the segment. You already met Jody West. She can reintroduce herself as the coordinator.
Yeah, so I just manage all of the operations and communications, and I'm a social worker.
There you go. And Lena.
Hi, everybody. My name's Lena Reguette. I am an LCSW and also the mental health consultant for the provider-to-provider consultation line. And I'm also providing some IT support for our Echo today. Glad to be here.
Thank you, Lena. How about Lisa?
Hi, I'm Lisa Spence. I'm one of the hub team, part of the hub team for the PPCL. I'm at St. Bernard Community Health Center, and I'm a pediatric nurse practitioner in primary care and also do behavioral health.
Thank you, Lisa. And Dr. Queen.
Hi, I'm Dr. Katie Queen. I'm a pediatrician. I work mostly out of Bogalusa, Our Lady of the Angels Pediatric Clinic, which is part of Our Lady of the Lake Children's Health. And I am not a psychiatrist, but I feel like I am sometimes, and I see a lot of pediatric mental health, especially in rural areas. I also do obesity medicine, also have a lot of overlap with behavioral health for that, and I'm honored to be part of the hub team.
Thank you, Dr. Queen. Our goal today is sort of to provide interactive discussions amongst our experts with our spoke team participants, which are everybody else, you guys. If we had a smaller group, I would go through and have you introduce yourself. But since we have a larger group today, I'm going to ask that in the chat function to just put your name, your specialty, if you're a social worker, nurse practitioner, a doctor, and where you work, like where you're and what city too, where you're coming out of.
Start with the didactic presentation. Dr. Olivier, go ahead and get started when you're ready, and I'll advance the slides for you.
Sure. Thank you, Jen, because that was a really good case. That was a very thought-provoking case too. And I was even telling Jody before we began, I was like, I've been out of residency 10 years and I have not come across a case like this. So that was a good one. So I appreciate you. We're going to shift gears, nothing related to the case, but we're going to talk about adolescent substance use today. This is a brief presentation, so I wanted to kind of hyper-focus on trends and treatment, because I think that'll be most relevant to your practices. So we're going to talk about the latest trends in teen substance use. The first part of this is a little bit interactive, so feel free to unmute your microphones and shout out the answer to the questions coming up. I think the answers might be on the slides though, because you can't put animations in these slides, so whatever. And then we're going to talk about treatment options available to youth in Louisiana specifically. And then we're going to review some clinical pearls if we have time, just from my experience on talking to teens about substance use, even as of yesterday. So go ahead. So the trends we're going to talk about come from the Monitoring the Future study. This is a study that's been conducted since 1991 out of the University of Michigan. This study polls 50,000 8th, 10th, and 12th graders every single year and tracks trends in substance use across the nation. Now, what's very important about this study is that we're going to talk pre-pandemic and post-pandemic, because the pandemic really caused some interesting trends and disruptions in teen substance use. And so it's important to talk about kind of what happened with these trends. So go ahead. All right. Okay. No, we got animations. All right. So the answers aren't on the slides. Okay. So when the pandemic hit, overall teen substance use declined, increased, or stayed the same? Shout out the answer.
Increased.
It actually declined. So everything, use across the board declined. And we think that's because they didn't have access. They weren't hanging out with friends. There was more parental supervision because everyone was sort of quarantined at home. So teen substance use across the board, every single substance declined during the pandemic. Now, what's happened since the quarantine? What's happened since the pandemic? So what substance has the highest level of use amongst adolescents? There goes my animations. Alcohol, and it's always been alcohol. Even though we see a lot of cannabis out there, we see a lot of vaping out there, alcohol has always been number one. Since 1991, alcohol has always been number one. What happened after the pandemic is that alcohol returned back to pre-pandemic levels. So there's the one substance that dipped during the pandemic and is right back at pre-pandemic levels. What percentage of seniors used alcohol last year? I was surprised by this, but 52% of seniors had reported alcohol use within the last year. So half of seniors are using alcohol. Keep going, Jody. Okay. What substance is the second most used amongst teens? It's marijuana. That wasn't always the case. So marijuana, it was usually up until about 2016, alcohol was number one, cigarettes were number two. And then there was a huge decline in cigarette use and marijuana became number two. So marijuana is still significantly lower than pre-pandemic levels, which is interesting. So there was this huge rebound with alcohol, but there wasn't a rebound with marijuana use. So we'll talk about that a little bit later. But one thing I want you to be aware of is marijuana vaping is starting to rapidly increase. And I have a picture. This is actually a vape pen of marijuana. It's kind of scary looking. I'm like, what is in there that they're putting in their lungs? It's some sort of synthetic oil that these teens are vaping, and it's causing some health issues. But keep going, Jody. So what's the third most common substance that's quickly catching up to number two? And that's nicotine use, in the vape form of nicotine use. So in 2016, we saw this huge decline in adolescent cigarette usage, but then boom, out came Juuls, out came Altos, all these vaping devices that initially their marketing campaigns targeted teens and made it look fun. Also, that contributed to this use of vaping is self-advertising. So amongst Twitter, TikTok, Instagram, teens can self-advertise to each other, and it's not regulated by the FCC. So that's a relatively new phenomenon since the advent of social media. So vaping nicotine is still in third place. It's still at lower levels than pre-pandemic. So marijuana and vaping did not rebound after the pandemic, and so we're kind of surprised by that. But it is on the rise, and this is one thing I talk about teens a lot with in my practice. But you can see why they're attracted to it. All these different colors, and there's so many different flavors. I mean, it's very attractive for teens to use. Next slide. Okay, so what is the importance of the 2021 and 2022 data? So marijuana and nicotine use for 2 years did not return to pre-pandemic levels. It didn't rebound. So there's two theories as to why this is going on. The first theory is that teens still don't have access to these things. So there's one theory that the disruptions in their ability to obtain the substance, to hang out with their peers that are using the substance, or to use it outside of parental supervision, have not come back. But that doesn't explain why alcohol rebounded and these two didn't. So there's a second theory that's that's very important neurobiologically. And that's that this year of abstinence during quarantine may have reset patterns of addiction, of addictive behavior, specifically for nicotine and marijuana. So that a 1 year delay or halt in drug use during adolescence may lower the adolescent's drug use level for their years ahead. So they're going to be looking at this very closely. They're going to be looking at what the data from marijuana and vaping do in the years to come. And the theory is that maybe these adolescents have been spared psychological or neurological changes that increase their susceptibility for future drug use. And what this might do is it might change our approach to substance use treatment. If we can get teens to have a year of abstinence, this might change their neurobiology for the future and for resetting patterns of behavior and addiction. So it's just something to watch out for. Other substances we'll mention these. We won't harp on these for too long. Cocaine, hallucinogens such as magic mushrooms, psilocybin, heroin, prescription opioids. There was an increase in it, but they're still not back there was an increase back to pre-pandemic levels. So again, it just reiterates that vaping and marijuana are some major outliers in this data. And then there were also some increases that did not return to pre-pandemic levels for ecstasy, crack, and tranquilizers. What's interesting about this, steroids, anabolic steroids, and performance-enhancing substances such as creatine, they saw a significant increase in use during quarantine and post-pandemic. And the theory is that a lot of teens were working out and focusing on fitness, and so they're using more and more of these performance-enhancing substances to increase their fitness. So this is something that is just to be aware of, and maybe to start asking about in practice too, because honestly, I never ask about steroid use or fitness enhancer use, but hopefully after this, I will. Also, just of note that the prescription use of ADHD medication in teens jumped from 11% to 15% during the pandemic. And that to me was kind of to be expected a bit because of the more demands, the rigidity of the learning environment being in all virtual, at home, sitting, having to focus harder and engage more. So it's just to note that. Yeah, my steroid. Okay, so that's the basic level of trends going on right now. Remember, alcohol number 1, marijuana number 2, vaping number 3, but quickly catching up to marijuana is number 2. So there are different levels of treatment. You probably know some of this already. There's outpatient treatment, which is, when I consider outpatient treatment, is once a week or once every other week, meeting with the provider. Then there's intensive outpatient treatment and partial hospitalization programs. In the state of Louisiana, we just started having intensive outpatient programs sort of pop up for adolescents. There's currently 4 in the state right now, and a lot of them are virtually based, and we'll go over them in a few slides down the road. There's also residential and inpatient services, and then there's also medically managed intensive inpatient services, which actually doesn't apply to teens. We don't have that in Louisiana. So next slide. So for treatment, the best and the strongest prognostic indicator for teen substance use is parental involvement. So if you have a teen and the parents are not involved with their substance use treatment, it doesn't mean that it won't get better, it won't improve. It's just that it makes it a lot more difficult. So step 1 is to get the parents involved. That's the most important thing that you can do. And step 2, community involvement is better. So the more resources you pull in from the community, the more involved the family is as a whole, even extended family, that's better prognosis for that teen. But also we know too, based on data, that any treatment is better than no treatment. So any treatment can help improve the prognosis for a teen than no treatment at all. So even if the parent's not involved or the parent's minimizing the teen's issues and use, it's okay. Get that teen into treatment. It still will help. So how to find treatment? That's the trick in Louisiana, because we are very, very under-resourced, especially when it comes to teen substance use in Louisiana. My go-to is insurance case management. Even with the Medicaid programs, private insurance, you can always call, the parent can call that number on the back of their insurance card and ask them, what resources do we have for teen substance use? That's, to me, the number one go-to. Especially when it comes to finding like an individual counselor that specializes in it. Call that insurance. SAMHSA, I'll put the number for SAMHSA on here. They have a national helpline that can help guide you to resources as well. And then drugfree.org also can help guide to resources. And they also have free online groups for teens and parents and their families. And so I put the link on this slide too. And you can also text that line. So what I say, my kind of criteria for treatment, if it's alcohol abuse, not dependency, marijuana use, or vaping, and they need substance treatment, they can start at the lowest level of care. In fact, the Louisiana Children's Code reads that teens have a right to the lowest level of care for treatment. So they sort of have a right to try outpatient treatment first before, and before going to rehab or a residential program. They can try outpatient treatment first. You notice I put family therapy on here first, because the first recommendation would be family therapy, because substance use it's a pervasive issue. It's not just an individual issue. It's a pervasive issue, and the whole family needs to be involved with this treatment. If you can't get the family involved, or even if the family is agreeing to family therapy, it's also important for that person to have an individual counselor that preferably specializes in substance use, but any sort of counseling is better than none. So family therapy, individual therapy. They also have group meetings. They have teen AA meetings, and the number at the bottom is the national line to find an AA meeting. So you can call this number, tell them where you live, and you can tell them, I'm looking for a teen meeting, and they'll help guide you to that resource. You can also do random drug screening at home or the PCP's office. I say the PCP's office is better for low-income families is because you can bill for that. Whereas these home testing kits, they cost money. I looked it up on Amazon, like how much is a home testing kit? And they're kind of pricey. For $30, you can get 7 of them. So the cost of those can kind of add up. But real quick, how do you do random drug screening at home? You put the numbers, you cut up paper, numbers 1 through 10, you put them in a hat, a jar, a bucket, and every day you pull a number and you decide on a number. So my number is going to be 7. 7's always our number. Every time you pull the number 7 out of that jar, you give your teen a test that day. And so every day you have to be consistent about it. Every day. Wednesday, we pull a number. It's number 1. Okay, you're not getting tested today. Thursday, we pull a number. Oh, we pull number 7, you're getting tested today. That's how you do random drug screening at home. And then there's also treatment. A treatment option is mentorship too. Getting your teen hooked up with a mentor through the church, through the school, or other organizations, Boy Scouts. But like I said, it takes a community when it comes to substance use. So all these things, I would recommend parents try all these things to get their teen in treatment. Next slide. So say the teen has failed outpatient treatment. They failed their random drug screening and they're already doing individual therapy, or there's evidence of kind of a more serious issue. So if a teen is showing signs of alcohol dependency, that's rare for a teen. So that means they need a higher level of treatment. Or if they're using stuff other than vaping and marijuana, that's also very rare for a teen. So this, to me, in my mind, requires a higher level of care. If a teen is using cocaine, that's a big deal. If a teen is using meth, that's a huge deal. So for those teens who show alcohol dependence or are using other illicit substances, I think they need to start off with a higher level of care off the bat. So an intensive outpatient program would be the way to go for them. They do have some virtual options now. Most are group-based, but they do have some individual therapeutic sessions in there. They have family-based sessions in there. The family has to be involved with an intensive outpatient program too. That's one of the requirements. So that's kind of why I like the intensive outpatient programs. Intensive outpatient programs doesn't mean you stop your individual counseling either. You do these in conjunction with individual counseling. You do it in conjunction with AA, NA teen meetings. So it's another intensive resource. And there's also drug courts, but the teen has to have a charge, even if it's a minor charge. The drug court system, I've had some teens go through it, and actually what drug court helps with the most is continued abstinence. And now we know from monitoring the future that continued abstinence for a period of time, usually with drug court, it's 2 years, can be huge for setting up their patterns of addiction later on. Next slide. So this is a list. There's 4 adolescent intensive outpatient programs. I'm more familiar with the third one, the Genesis Holistic Program. It's based out of Baton Rouge, but it is virtual. I have a teen here in Lafayette doing the virtual program through there. And I love it because they have teen meetings and they have parent meetings that go on at the same time. So I know the parents involved in their treatment. Vermilion is opening up their IOP today, in fact, and they are going to have a virtual option as well. Vermilion's located in Lafayette. There's one out of Covington, and there's also Jefferson Oaks, which is also out of Baton Rouge too. It's a well-established IOP for teens. I just don't know a lot about it. Next. And this is just a list of the drug court programs. They're usually in the bigger hubs of cities like Caddo Parish, Calcasieu Parish, Lafayette Parish. 2 slides ahead is the number to the drug court program. So that is an option for the teen if they have even a minor charge, even if it's a misdemeanor. What they do is they hook them up with a probation officer, and that probation officer holds them accountable. They have to meet with a substance use counselor. They have to do random drug screening on a jacked up level, not just the home random drug screening. And they're accountable to that probation officer for 2 years. So it's a great program. It's very intense though. And then the highest level of treatment is inpatient. You can PEC a teen for substance use if there's evidence that they're hurting themselves or gravely disabled from it. You can keep them up for up to 15 days for substance use on a PEC in the state of Louisiana. There are residential treatment programs, and I put the link for the list. There's only a couple in the state of Louisiana that these are 30-day programs. These are what the teens call rehabs. There's 2 that take Medicaid is what I'm saying. There's more private ones. There are out-of-state programs like a wilderness program, and this puts teens out in the wilderness to survive with a tarp, a rope, and a mat to lay on the ground, and they earn privileges as they go through this program, but it's about 6 weeks long. And there's also the Youth Challenge program, which is put on by the Louisiana National Guard, and teens do this program for about 6 months, and then they leave having a ranking in the military, and they get their GED. But they have to go willingly. That's the check. So I have about a minute, and I'll go through these clinical pearls pretty quickly. When you talk to teens, getting teens talking about substance use is the hardest thing because they don't want to talk about it. They don't want anyone to know about it. So just some pearls for you. Use specific substance names. So not asking, do you drink alcohol? Ask specifics. Do you drink beer? Do you mix vodka or rum in anything? Do you drink those seltzers? What do they call them? Trulies or White Claws? So asking them specifics, you'll get more specific answers and more honest answers. Approach them with curiosity. So instead of saying, do you use marijuana or do you vape? I'll go a roundabout way of saying, I had a patient in here the other day that said, all the kids are vaping in the bathroom. Like, is that happening at your school too? Like, has anyone approached you about vaping? And you're going to start a conversation between you, and it's going to be more revealing, because if you ask them, are you vaping? They're just going to say no. Be sensitive that the parents may be supplying them. That's a big deal. Also, self-report questionnaires, that takes away the face-to-face kind of threat, but so you might get more honest information from a self-report questionnaire, but you follow it up with a good clinical interview and a drug screen. Follow it up with a drug screen, because if they're saying they use marijuana and it comes up on a drug screen, then you got some trust that's been built there. And also remember, confidentiality is important. Substance use is one of those, it's protected. You don't necessarily have to tell the parent about it. And the team's not going to talk to you about it if they know you're going to go tell the parent about it. So it's better to have those conversations between you and the teen of what's reportable. You have to report it to the parent if it's gravely disabling the teen, or if it's threatening their health or their life. We're going to skip the next slide. I just put this one in there because teens love to dispute with me that marijuana is not that bad. And so I just put some facts about marijuana down there to help you if you have a teen that comes in and is trying to dispute this with you, to kind of help your argument along. All right, we have a minute left. Any questions?
Thank you, Dr. Olivier. If there are questions, you can either stick around and discuss it after, or you can email ppcl@la.gov. We can make sure Dr. Olivier gets them. So we will hang on for a few minutes after, but it is 12:59. So we are going to put in the chat the link to complete the survey for continuing education credits. If you're interested and like those, you have 48 hours to go ahead and do that. So we'll email it out as well. So please do that survey if you're interested in that. And our next session will be on June 13th at 12 noon, and we will send out information again for you to sign up for case presentation and to attend. So thank you all so much for your time. Thank you, Jen, for your case presentation. Thank you, Dr. Olivier, for your presentation. We'll stay around if you have questions. If not, have a good afternoon. And thank you for coming.